Hello, my name is Christine Diaz, and today I will be presenting different treatment approaches and care options for mental health needs. I will be focusing today mostly on anxiety, depression, and stress. And before getting treatment or seeking resources, one must understand their diagnosis. Mental health is not a one size fit all, and there are several types of disorders, and the symptoms can vary as well. Today, we will be touching first on anxiety. We are all going to get anxious feelings throughout life with different circumstances, but when it overcomes your life, this is when one person might want to seek help. Like I mentioned earlier, there are several types of anxiety. First being agoraphobia. This is when people want to avoid certain places or situations because they start getting extremely anxious. And like I said, we all get that feeling inside of ourselves, but when it overcomes us and we are physically unable to enter a building or have conversations with people and our symptoms heighten, this is when you may want to seek treatment. There are also panic disorders when people begin, as I mentioned earlier, their symptoms heighten, which we will talk about the symptoms later, and as well as substance induced anxiety disorder, which will occur when there is misuse of drugs or medication that then heightens our senses. Different symptoms are feeling nervous, restless, or even tense, having a sense of impending danger, panic, or doom, as well as increased heart rate. These are just a few examples of some symptoms, but as mentioned earlier, they can range. There are many evidence-based practice for anxiety. One that has had several positive effects has been CBT, cognitive behavioral therapy, and it is known to be most effective form of psychotherapy for anxiety disorder. It is short term. It teaches specific skills to improve symptoms. It includes exposure therapy, where if you, for example, if you're scared of going to a place, then you will have to continuously go, and that fear will eventually go down. As well as clients are able to return to their activities that they've avoided. This is something that is beneficial, and it changes your thoughts, your feelings, and your behaviors. It believes that they are all connected, and it works together to uh, allow people to overcome their anxiety. There's also depression. Depression varies as well. There's major depression, there's persistent depressive disorder, and there's even seasonal depression, which can come and go as well. They're not all, depression may not look the same for everybody. It might not always happen. It can come and go. Certain things can trigger it. But when, like I said earlier, when it starts overtaking your life, this is when you may want to seek different resources and treatments. Symptoms can include persistent sadness, anxiousness, or a mood feeling empty. You can have difficulty sleeping or waking up too early in the mornings as well, or even oversleeping. Changes in your appetite or excessive weight gain or weight loss can be symptoms of depression as well. If you are feeling these things, there are evidence based practices that have proven to improve people's lives. Um, One being cognitive behavioral disorder as well. There's also interpersonal therapy, which focuses more on relationships, problem solving approaches, and it's also a time limited treatment. So, this is something that people may lean towards. There's also different medications, such as antidepressants. This might take 4 to 8 weeks for it to work. And it is something that might be more long term. And now we will be talking about stress. Stress, again, is something that it is inevitable, but there are times where it begins to affect our lives, our mental health, and even our physical health. There is acute stress, chronic stress, and traumatic stress. Feelings can Symptoms can range from burnout, fatigue, and anxiety and depression as well. Evidence-based practices for this can be mindful based stress reduction. This can include body scanning, where you lay down and you feel what you're going through. A lot of times when people are stressed, they kind of just let life pass them by. This is a time to be mindful, stop, feel your body, as well as gentle yoga, moving your body. This stress can manifest within the body and give you physical symptoms, and getting loosening up your body can be a great practice, as well as meditation. As I said, stress usually comes from the fast-paced life of the this culture has developed hustle culture, and so taking that time to sit down and really meditate can be a great evidence-based practice. There are also resources for all of these things. For anxiety and depression, a national program and resources can be National Alliance on Mental Illness, or known as NAMI. Why it works. More than 60,000 advocacy actions have been taken by NAMI. They have over 700 states and local affiliates nationwide. 93% of people who use these resources recommend their helplines as well. And they have peer led social groups, which gives people a sense of support. There's also for stress national program called Stress Management Society. It has online workshops and events. It allows you to take stress tests. They have achievement plans, and they have a trustworthy team that you can find on their website. These are just a few of the resources and treatments that can be for these mental illnesses, but they have been known to work throughout the country. The mental health, like I said, can range, and anybody can suffer from it. So if you feel as though you are having issues with your mental health, I hope that this presentation has helped. The links for the national programs and resources are listed below. And I hope that you guys enjoyed this presentation. Thank you so much. Again, my name is Christine Diaz. Have a great day.